Namaskaram. Autism is not a limitation, it's a different way of experiencing the world. Today, we are going to understand it better with Dr. Shankar Prashant Mozat, a specialist in autism spectrum disorders. Welcome to the show, sir.
See,
Doctor, can you explain in simple words what is autism spectrum disorder and some myths are around this, right? So, can you correct that some misconceptions?
surely, because right now what we are seeing is in a stage, a kid will be dancing, kid will be showing some shows, and they will be singing, and the caption will be autism kid is singing.
Yeah.
Actually, most of that cases that may not be autistic, that maybe mental retardation or cerebral palsy. Such cases also will be there. But
Okay.
commonly, people think that they will put the name as autism because
Autism.
people know the name autism. So all the parents think that the kids will sing like that. So such a misconception is there. So in Ayurveda, we say we can differentiate autism in a simple manner.
Okay.
Because our mind is having three qualities. In Sanskrit, it says that dhi, dhriti, and smriti.
Okay.
These are three Sanskrit words. The first one, dhi, is nothing but intellect. Second is dhriti, that I will tell you in the last. The third one is smriti. Smriti means nothing but memory.
Memory.
So the first one is intellect, third one is memory.
Memory.
The middle one is the dhriti. Dhriti is nothing but to make use of this intellect and memory in the proper place. Because every parent says that he is highly intelligent, he have good memory,
Yeah.
but he don't know where to place it.
Place it. Yeah.
So Ayurveda says we need to work on that dhriti concept for an autistic kid, not merely working on to increase memory and intellect. So it's a concept called correction of dhriti as per Ayurveda.
Okay.
So it's a merely behavioral issue, nothing else.
Okay. Doctor, is this autism is a genetic issue?
As per my personal experience since 13-14 years,
Okay.
I will not say that it is a genetic issue. Maybe 1% it will be there. I'm not saying 100%. Why? Because most of the parents that came to us and wherever we have done the studies, they said that till the age of 2 years, 2.5 years, he was speaking, he was having good eye contact, he was playing like with other kids, that emotional attachment also, everything was there. But sudden onset,
Yeah.
everything has gone.
Change.
So maybe some hospitalization maybe happened. Many other causes also will be there. But ultimately we can say in our experience it's not genetic.
Genetic. Okay. So once a parent find the child he or she is in an autism condition, they will start give some speech therapy or behavior therapy. Is it enough or any other interventions needed?
Surely, because right now we need to see how they are going for this therapy.
Okay.
Because it's a stage wise progress. We'll be going to some pediatrician, they will be saying that some speech delay is there. Okay, you just do speech therapy. This will be the advice of that doctor or whoever the medical professional.
Okay.
They'll be giving speech therapy for 6 months.
6 months.
Then they may not be seeing much changes in speech. And sometimes that therapy center will say that, okay, we will do occupational therapy along with speech.
Okay.
So after 6 months, they will be starting even occupational therapy. Even after that, if we are not finding proper result, they will suggest he is having some sensory issues. We will go for sensory integration therapy.
Okay.
So they are hearing these things one by one after 6 to 8 months, 1 year after that.
Okay.
But what I feel is even planning of therapy is more important than giving therapy. How to plan? How to plan in the sense the assessment has to be done properly.
Okay.
Because most of the assessment, 75% of the questions are asked to the parents.
Parents.
So we know that if father is filling that assessment form, the score will be different. If mother is filling, the score will be different. Because it's depend upon the mindset. Ultimately we can say it's a subjective.
Okay.
So what I feel is it should be more perfect in diagnosis first. If speech therapy has to be given, we need to rule out whether he or she is having any sensory problem first. He or she is having any behavioral issue first. To that, what we do is we will do a secondary assessment for parent to find out what is their mindset. Because some parents are there, maybe the symptom is very less, they will exaggerate the things and say the answer.
Yeah, I think today's many children are delay in their speech, right? So parents thinking like they are also autism.
Yes, 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 because speech, not only the speech delay is a problem. We need to find out if any these kind of
Yeah.
sensory issues, our five sense organs are
Okay.
there. If any hyperactiveness of the sensory issues also will make a speech delay.
Okay.
But not only speech therapy is the answer. For
Okay.
that, we need to give
Understand.
prime importance to sensory integration.
Okay.
And
So many
OT.
factors are there to
Yes,
confirm the
yes, yes.
autism, right, sir?
It's not blindly going for speech therapy or behavior therapy. In
Okay.
speech therapy itself, there are more than 15 to 16 varieties of interventions, like auditory sensing will be there,
Okay.
articulation therapy will be there, speech enhancement therapy will be there, speech modification therapy will be there.
Okay.
To find out which has to be given, proper assessment is needed.
Yeah. So first initial stage, first diagnosis is the first.
Diagnosis is the first.
Yeah.
That too, normal assessment, parental assessment, and 3-4 sessions of assessment therapy has to be given, so that the professional can interact with the kid, giving him some task, and they will assess whether he or she is doing. With this 3 assessment, the assessment will be, the diagnosis will be perfect. With that, they need to plan which therapy has to be given preference.
Okay.
Accordingly, it should plan, not according to the need of the parent.
Okay.
Then we will lose the right path.
Okay, understand, sir. Okay, doctor. So, what is your line of approaching these autism children when first time they came to you, your side?
Actually speaking, the before question was there, we will also assess.
Okay.
Because in a broad spectrum, we can say we focus on Ayurvedic point, second one diet, third one proper therapy.
Okay.
Planned goal set therapy, we will say.
Okay.
This is a broad spectrum. Minutely, we can say we go in a protocol like 8 matters are there. The very first thing is the food. Because Ayurveda says the food that you take today will have impact on your mind and behavior on the 4th day.
Okay.
Or else we can say today whatever the emotions that you have, it's an impact of food taken 4 days back. So accordingly, if a kid is taking proper sattvic diet, his mind will be sattvic, he will have a listening quality will be there, sitting tolerance will be there, etc., etc.
Food is that much important.
Food is that much important.
Okay.
So because in Ayurveda we say that anna is the first thing.
First, yeah.
The second one, sattvic thoughts, we will say.
Yeah.
Because what the experience is, the parent will be coming with a very much tension. If their mind is perplexed and not able to take a proper decision, that will have a negative impact in the kid.
Yeah.
So they should have a focused mind.
Their circumstances.
Circumstances will be there, family, other issues may be affecting.
Okay.
So the parent should have a sattvic thought,
Yeah.
or else we can say spiritual thought. They should not feel that this is as a burden. It should be a blessed
Yeah.
condition for them. Even the therapy has to be planned properly.
Okay.
Ayurvedic intervention, actually what we do is, we do a basis of gut-brain theory.
Okay.
Because it says that whatever we need to do to the brain, we need to take the help of the second brain. The second brain is called the gut. So the gut correction, for that we will take the help of Ayurveda.
Okay.
Even the gut correction, body cleansing, if any heavy metals are find out, we need to
Okay.
cleanse it. Then we will go for brain regeneration. So Ayurveda also will have an impact. Every important thing is the art of positive parenting, we will say. Parent has to study many things.
So parenting and the circumstances are very important.
Very much important. So it's a
Okay.
combination of more than 8 things that we will say. We call it as an Ashtanga protocol.
Oh, really? Okay.
So that it's a multi-dimensional way. Even music therapy we are
Okay.
using. Some yoga postures we will be teaching for the parents.
Okay.
So it's a combined effort of everyone.
Okay. So this autism is curable, or the children need lifelong support?
That's also the first question that you asked. It's a myth.
Yeah.
As per our experience, what we say, if all the things that we say, parental support, proper diagnosis, proper therapy, proper intervention of Ayurveda, proper family if everything comes good, we will be able to bring them to the mainstream.
Okay.
Why we are saying is, we are having a school process also. We are
Okay.
having a bridge school.
Okay.
It's a very new concept in this field of autism.
Okay,
Because
great.
everywhere we will see shadow teacher concept, inclusive schooling we are seeing.
Yeah.
But bridge school, the concept is immediately we can't put them to the normal school. So last year we have shifted 4 kids from special school to normal school
Oh, great.
with a process called a bridging.
Okay, so
We will
we
put
can.
them to the grade 1, grade 2, grade 3,
Yeah,
then to
okay.
the normal school.
Oh, okay.
So that much support we need to give, parental support needed,
Yeah, so hope is there.
surely.
Sure.
But they should put their 100%. Then we can give it.
So, this present era, how can a parent can implement this every protocol in their lifestyle?
Yes, whatever we have said, I think 10, 12 years back, I used to give advices regarding this.
Okay.
So, that time I came to know that as a parent, very difficult to implement a new protocol in the home.
Yeah.
Because I am also a parent. It's
Yes.
very difficult to control my kid. Because after some time, my emotions will start work.
Yes.
Because my logical thoughts, I will leave it.
Yeah.
I will go for my emotions. That every parent will do. So since 7-8 years, what we are doing is we will give a training process of these kind of whatever I said about Ashtanga protocol.
Yeah. Okay.
They used to come to our campus. They used to stay there for 21 days.
Oh,
In that
okay.
21 days, we'll be doing, in Ayurvedic part, we'll be doing, first 7 days we'll be doing proper gut correction. Second 7 days will be proper body cleansing will be done. Third 7 days there will be proper brain regeneration. This is what Ayurveda will do within this 21 days. Within 21 days, we will correct their biological clock. What time he should get up, what time breakfast, lunch, dinner and sleep. Because as I said, that biological clock is controlling our behavior and emotions.
Okay.
So
Understand.
it's a specific timetable will be there.
Okay.
So if you follow that for 21 days, that will be habit for the kid automatically. So after going from here also they can follow it.
Okay.
Third one, as I said, proper assessment and proper planning of therapy. So that part will be done. Within that time period, we will be controlling. We will come to know the parental mindset.
Yeah.
So that 21 days will be over, and they can go back. After 6 months, before 8 months, they need to come again for 14 days.
Okay.
Again after 6 months, before 8 months, again they need to come for 14 days.
Okay.
This is the whole process. The 6 to 8 months gap, why it should be means for every kid, in the time period of 6 to 8 months, the gut impairment will happen again. So again we need to boost up. That's the time period for 6 to 8 months. They need to come again for 14 days. So in this process, if we do, they will be picking up. And along with that, as I said, we are having a schooling process. Many parents are staying nearby that school, and they will be putting them to the 9 to 4 session schooling plus therapy.
Okay.
So automatically the diet will be taken care. They will give proper. They will get proper therapy protocol every month. We should get a change.
Okay, so throughout this process, not only the child, the parents, their lifestyle also going to change.
Yes,
Their
yes.
mindset
Whatever
also
the
going to
diet
change.
that we are saying, it should not be for the kids' diet. We label it as a family
The
diet.
family.
Because
diet, yeah.
unless until we follow, it's not fair that we should tell them to follow.
The parents should also change for the child.
Yes.
Right.
Minimum,
That's
what I
happening.
say is minimum 1.5 to 2 years.
Okay.
Family should change.
Then only the child will come to the normal.
You just think about in your home, your family member is eating chicken and mutton
Yeah.
and giving you some salads. How you will feel?
Yeah.
The same way kids will show the tantrums and craving will be more,
Yeah.
and saying that hyperactivity increased. It should not be done.
Okay, understand, sir. Sir, what are your institutions for autism children? I heard you have a hospital and you have a school also, right?
Yes, actually, we are having a 30-bed hospital in Alapi district
Okay.
of Cherthala. The proper place is Tannirmukkam. It's a small village.
Yeah,
My
okay.
home is also there.
Okay.
It's in the campus, the same campus. My home is around 600 years old, the old Naligattu.
Okay.
So
You're
nearby,
also living in there only?
yes, we are
Yeah,
living
okay.
there. So there itself is a 30-bed hospital is there only for autism. It's first time in ever we have seen only for autism. Because this protocol, it may not be suitable for other cases. And in Tannerumukam itself, we are having a child development center where speech
It's a nice
therapy,
place
behavior.
also.
Yeah, Tannerumukam Bund, it's a famous one.
Yeah.
Speech therapy, behavior, sensory integration, everything is there.
Okay.
And there itself, we are having a goshala because we promote A2 cow's milk.
Oh,
It's a concept called because that's also related to autism. Because if we need to give some milk, it should not be A1 milk. There is very difference between A1 and A2 milk. So we are having a goshala, and we are having a child development center in Cherthala.
Okay.
And there also all the facilities plus that what I said that bridge school. We shift from special school to normal school in a grade 1, grade through to grade 3 process.
Okay.
So that with therapy, if we keep them 9 to 4 session, it will be like a schooling. Then we will send them to the normal school.
Doctor, so where parents can meet you?
Actually speaking, since 7-8 years, I used to travel a lot.
Okay.
Because right now I am having consultations in Chennai, Hyderabad, Bangalore.
Okay.
Madurai.
I had also you're traveling a lot for the
Yes.
children.
And second week I will be traveling to Madurai, Calicut, Trivandrum.
Okay.
And in Changanasheri it is there, Ernakulam, Palakkad,
Why, sir? Why
Thrissur.
you're traveling a lot like this?
Yeah, even recently I have started in Kolkata and Mumbai and Delhi. So
that's
every
great.
month I used to go these all places.
Oh, okay.
Because the intention of traveling is, I used to see the Nadi. You have seen that Nadi diagnosis. Because as I said, if we have an interaction through online, the informations from the parent side only we will be getting. But if I see them directly, the impact will be very much.
Okay.
And those who come for treatment in Kerala in our hospital, it's our responsibility to give proper follow-up.
You're putting
Every
that
month
much
we need to
effort
have
in that.
advice, and as you know, the parents will be very much tensed. So we need to give proper support to them.
That's a great thing, sir.
That's the only intention why I am traveling. I think I will be in my home only for 5 to 6 days in a
You are
month.
putting that much effort in this.
Yeah, because everybody has their own karma to do in the whenever we come here.
Yeah.
So everybody has to do something. Maybe. Actually, I was working in Kottakkal Ayurveda since 2011.
Okay.
Till 2016, I
From
was a
that-
staff of Kottakkal Ayurveda in the head office.
Oh,
I resigned that job. Maybe that day I may not be having much intentions, but somehow we came to know that my purpose of life will be something related to autism.
Why you choose that, or why your life you choose for the autism children? Is there any reason behind that? Any
Because
story or anything?
no, it's merely accidental, we can say. Because in 2011, I feel 11 or 12, my elder son, right now he is 11 years old.
Okay.
When he was carrying, I just came a thought that I should know what is going on. So that time I had a discussion with many people. I wrote a book called Supraja.
Oh.
It's the concept called how to get a good progeny. Because 3 samskaras in Puranas it is said, before having a kid, having a thought of a kid, what we should do. Because Ayurveda says the food that you take, it will have impact on your semen at the 41st day.
Okay.
Or else if you are having some relationship today, the semen quality will be decided 41 days back, the food that you take. So with that book, many people are inquired. So 2-3 kids came. Somehow that has been better. So then I gone for Ayurvedic PG in Dravya Guna. After that I took PG child psychology from London, only because to know how these 2 kids got relief. And after that we need to study more. So that's why I told it's an accidental. It's not planned.
But it's blessed for so many children.
Maybe. Let's see. And right now, it's not only from me. We are having more than 45-50 staffs to support us. Even 7 to 8 doctors are there.
Oh, okay.
Because staff number should be more.
Okay.
And for therapy also, it's not easy to do for the autistic kids. Some oil massage, everything. They may be kicking, they will be biting, they will be throwing something. So with all that, I think my staffs are more than 10 to 12 years experience in our hospital itself.
Yeah,
So it's a blessing of all my family members. We call it as Illam family.
Illam families.
Illam family.
Yeah. Doctor, what message would you like to give to parents who are watching this and currently worrying about their children condition in autism?
The first advice, we can't say it as an advice. From my experience, I used to say that you just focus on your karma.
Okay.
Put your 100%, you will get the result. Why I said the karma means, yesterday I had a conversation with one of the parent. The kid is around 11 years old.
Okay.
They contacted me from Australia, I
Oh.
think Sydney. So the parent was saying that, sir, I have seen you in Bangalore when he was 3.5 years. Means around 7-8 years back.
Okay.
So I asked, why you are contacting right now? Since then I was following you, but some or other hindrance happens in our life. I was not able to. I need to, because all the videos, whatever the informations I am saying, he is by hearted that. But he is not able to reach up to our hospital and to get the treatment. And right now he said that maybe this is the time to happen.
Okay.
That means nobody, or we are not the driving person. Somebody else is driving us to get the proper approach of treatment. Not only with us, wherever we go, it's not matter how much money you have, how much position you are holding. Nothing else matters. Only thing, the time should happen.
Yeah.
So just pray, whoever the deity or the God that you are worshipping, just surrender yourself. You will get the proper path to get the proper treatment.
Okay.
So do your 100%. It's not a silly matter. Do your 100% and you will get the result. How much you face the difficulties, that much you will get the result. That is only pray, or even we can say advice or whatever, only to the parent.
Okay. Thank you, doctor. Thank you so much for your valuable messages.